Hi guys, I am standing right in front of the ECON faculty laboratory, and I will show you this morning what what do they have in the lab, which we'll go in and check. So this is the main entrance to the medical surgical laboratory, and as we enter into the main entrance, on the left side we have the store rack. The store rack, the impressed rack, that is where all the medical supplies are stored. As you can see, they have the IV fluids in there, the surgical consumables in there. As you can see, the povidons, IV fluids, oxygen tubes, IDC, the antitopical. In there we have they have the IV lines in there, and then all the IV medications in there. As you can see, all the oral medications in there, and other necessary consumables. As you can see, the gauze, and then probably this is the station. So they have a little station in here, and then we go to the storeroom. So this is wow. See those blankets. So these blankets are basically for the bed makings and also for the dummies. I will show you the dummies in a little while. So they have these sphygmomanometers, the stethoscopes, and all the other valuables items in there. As you can see, the stats and the thermometers and the oxygen saturation, the pulse oximeters in there. And as we go out, this is the general lab. So it consists of a four bed ward, a general medical surgical four-bed ward. So patient number 1, patient number 2, patient number 3, patient number 4. As you can see, well, they have a very nice beds there, so they're sleeping. So this is where all the students come around. They do all the practices, the demonstration, the tutorial demonstrations, practices, and then they assess when they're competent enough, they're competent, then that is where they will allow them to go to the ward to practice. So this is where all the practices are done, all the laboratory exercises, practices are done. They have the medication trolley in there. Can we have a look? Also, they have all the medications in there in the trolley, IV medications in there, and all the oral medications. Just for your information, I think all these medications are expired medications. They are only used for practice. Yes, practice-based, lab tutorial practice-based. So those are the patients, the medications, the cupboards in there. So they have the cupboards in there. They have what is there, okay? The buckets, the bedpans, dishes, Macintosh, dressing trays, kidney dishes, and all other extras. Okay, and in here, what do we have? Operating suite. So this is the critical care unit, and also that includes the critical and perioperative. Let's see. So they have a patient inside in the perioperative critical care unit, and this patient, hello friend. Hi, good morning. Sorry, this is a dummy. So this patient, wow, okay. So the setting looks more like a hospital. Yeah, so this patient is being connected to a patient monitor. So there's a patient monitor in there, and there's the emergency trolley in there, which is also used in critical and also used in the perioperative. So we have they have ambu bags in there. This patient is connected to intubated. So this patient is intubated, connected to an ambu bag, which is connected to an oxygen. That is the 5-lead ECG in there that is connected in there, as you can see, and the 3-way catheter in there, SpO2 and patient monitor. Well, and then we got a couple of IV fluids hanging in there, and the oxygen in there, the suction tube in there, right? And then the operation, the OT equipment in there, all the OT equipments, and then all the medications, critical care, IV fluids, there's gloves, medications. There we have what is this EDT, endotracheal tube, or yes, EDT tube in there, the suturing sets, syringes, okay, and very interesting, the EKG, the ECG machine in here. So this is a digital 12-lead EKG machine in here, as you can see. So this is very fortunate for the students. The students are using the 12-lead digital EKG machine or the ECG machine, where in some of the hospitals we don't have this, so that's very fortunate. So that is the brief setup of the critical care unit, Econ faculty. It looks great. Well, so basically that is that, and I think they are getting somewhere. Econ is getting somewhere. Yes, I think they have a proper good setup. Yeah, it is. I think it's interesting. Yes. Thank you guys.